Well, hi everyone. This is Dr. Schroder with, a somewhat belated introduction to our course here in curriculum evaluation and assessment. Normally, I like to do an occasional video during the class, maybe in weeks number 1 and again in maybe 4 or 5, just to let you know that there really is a face out there, that there really is an instructor that's live that will be working with you throughout the course, and to go over a little bit about upcoming assignments and talk about a little about or give some wrap up to discussions that we're having in class. And so we are recording this on Monday afternoon of week number 2. I posted an announcement in the course that, of course, I am down here in the Southern California area, and I actually live most of the days over the border down here in Rosarito, Mexico. And we have been impacted by the fires down here, and the wind events, and anybody from Southern California knows that the Santa Ana winds. It's been rather historic down here recently. So therefore, power outages and internet outages have been a fact of life for the last several days, although it looks like I'm into a window where that's not going to be too much of an issue moving forward, I hope. But we got off to a good start to class. Of course, really mostly we did our introductions, and we had our first discussion talking a little bit about the factors in the regulatory environment the curriculum evaluation takes place. In your coursework so far, you've talked a lot about evidence-based practice. You've worked through evidence-based practice. You've learned some of the basics of nursing education and some of the theoretical foundations of nursing. And so this is refining that a little bit and talking a little bit more about the nuts and bolts of what curriculum is and how do you assess and how do you revise curriculum when need be. And so week number 1 primarily was to talk about the regulatory agencies. The two most prevalent by far really for nursing regulation are for the 2-year associate degree programs is ASIN, and then for the 4-year schools is most predominantly CCNE. These are the regulatory agencies that oversee curriculum and really help to drive this whole process of what is it that we're doing? How are we measuring our outcomes? How are we ensuring that we have quality education program? And there's actually many other accreditation agencies beside that. Those are the two most prevalent that you'll hear about in nursing. And they're important. Nursing accreditation or nursing program accreditation is to schools what Joint Commission accreditation is for hospitals. It's a big deal. They come out every 3 to 8 years, depending on the regulatory agency, and along with the state departments of nursing or the state boards of nursing, really seek to oversee and hold the schools accountable to make sure that their curriculum is current and that is meeting current educational needs. And so that's where we left off our discussions in week 1. And moving on to week number 2, this week we'll be discussing how do we assess those needs? What are the tools that we use? What are the tricks that we use? And what are the nuts and bolts of actually determining what we need to do to revise a curriculum? When does curriculum need to be revised? How do we make that assessment? What do we do? And that'll be the focus primarily of week number 2. I had mentioned in week number 1 in some of the discussion question responses that a big focus right now in nursing education is preparing pre-licensure programs for what is known as the next generation of NCLEX testing. This is a big deal right now because the National Council of the State Boards of Nursing, or the NCSBN, which is essentially the coalition of all the state boards of nursing that determine the standards for the NCLEX, and they're actually the ones that write the NCLEX examination, they're about ready to revise a huge new revision of how that test is delivered. And they go through one of these changes. They go through relatively minor changes, scoring changes, and content changes every 3 years, and about every 10 to 15 years as they have a really big revision. The last big revision was when they introduced questions other than non-traditional questions or multiple choice questions. If those of you that took the state boards back before 2007 and 2009, all of your test questions were probably multiple choice, and you probably didn't have a lot of select all that apply, and it was still basically a knowledge-based test and didn't really get down to the synthesis of knowledge or the actual integration of knowledge into practice. If you're a real old bird like me, I took my NCLEX examination back in 1986. It was still pencil and paper, done over 2 days, and I can tell you lots of war stories about that. I won't get into that right now because, well, I don't want to keep this video too terribly long and it just kind of be boring. But just my point is that the test does change occasionally, and it's ready to go through a big change. The biggest change is that they're going to be getting away from multiple choice questions into primarily questions related to they call them cascading or continuing case studies, where a student will get a case study and they have to actually write a short nursing note, for example, on a case study, or they will have to identify in a priority order the information that was important in a particular case study and then information that wasn't important. And when I talk about case study, it's not just like a written case study, case scenario. It will then actually be looking, for example, at like a history and physical and a doctor's medical examination or medical assessment that you would see in an actual chart, along with a chart and a medical record with doctor's orders in it. And so the nurse or the student will have to go through and actually walk through how they would apply their knowledge in addressing several questions to those case scenarios. And that's going to be a large part of the question. So what that means is that those of us in nursing education really have to change our curriculum to match that. So that's an example of an external curriculum need that is coming up. And it is something that is that a lot of us in pre-licensure programs are really focused on right now. So I'll be maybe posting some links and incorporating that a little bit in the discussion this week. Then also this week you also have your journal position paper. This is a journal that you're writing. It is not a, although you can write, and I would recommend that you do write this in a Word format or in a Word document, but you won't actually be uploading it as a file. You'll be actually submitting it as a journal, and the instructions for that are in the syllabus. So if you have any questions for that, please let me know. The difference between a journal and a paper is just it gives me a little bit more ability in the way of giving feedback within the journal, a little bit easier than in the tools that we use for the for the paper. So I'll be able to give you some feedback, more specific feedback likely than you would get in a typical paper, related to your writing style and your ability to argue a position. Again, if you have any questions, go ahead and let me know. You can either send me an email. I have also posted my phone number if you need to get a hold of me in any kind of an alternative fashion. If my internet goes out, even if my internet goes out, I almost always have cell phone, and my text is almost always working. I haven't had it go out yet. So feel free to go ahead and send me a text message with a question if you have one, and I can answer it that way as well. I may direct you to go ahead and please leave me an email, because you really should be communicating with me via email for any classroom-related stuff. But if you don't see a response from me in a reasonable amount of time, say within like 24 hours when you leave the email, send me a text and I'll go ahead and check my email and make sure that you get that. I will be giving more feedback later as we go through with the class, but mostly I just wanted to get a chance to have you see me face to face. And I personally like it when class is as personal as it can be. And sometimes I know in an online program it gets to be like you're just talking with a bot, or you're just talking with somebody that doesn't, isn't a real person out there. And so yes, there really is a real person. It is me. I'll be giving you all the feedback in this class. And then as you have any feedback, or if you have anything that you would like me to talk about in one of these little video presentations, just let me know. They're usually, this one's about 9 minutes now. Usually, this is a little bit long. Usually they're about 3 to 4 minutes long. I don't, keep them too long. I promise that I won't be sharing anything that if you were to miss it for some reason, that it's not anything that I'm going to give you here that I wouldn't be giving also in a written feedback in the class. But like I said, it just is one of those things that I think makes class feel a little bit more real and a little bit more real time. So I wish everybody a great week. I hope that everybody has fun on Halloween coming up. Those of you that are Houston Astros fans, well, you got big nights coming up on Wednesday and Tuesday, maybe Wednesday night. Those of you Washington Nationals fans, I know you're probably biting your nails and are hitting kicking the dust in a little bit of disgust. Those of you that are any other team, like Dodgers fans or Yankees fans, well, we've all had to go through our various well, we've dealt with it in our various ways. So, but it is the end of baseball season, so I just had to kind of mention that here. So I hope everybody has a great week. I hope I haven't bored you too much, and I will look forward to seeing you in the discussion forums.